Hello. So today we will continue with the general histology slides. So coming to slide number 11, try to identify this particular slide and give relevant points in favor of identification. So in this particular slide, you can see the TS of axons which are covered by the endoneurium. So groups of such axons are further covered by epineurium, and such bundles you can see they are covered by the perineurium. So we'll go on to the identification points. So this is the TS of peripheral nerve, where you can see sections of axons. So individual axons are covered by endoneurium. Bundles of such axons are covered by epineurium, and further the number of bundles are enclosed within the perineurium. Occasional Schwann cell nucleus is seen. Yes, now we'll go on to slide number 12. So try to identify this particular slide and give points in favor of its identification. Here, groups of pseudo-unipolar neurons are seen. The nucleus within this neurons are central, and it contains many satellite cells. So groups of neurons are seen between the bundles of nerve fibers. Coming to the identification points, so it is usually encapsulated. The capsule is thick, so it contains groups of pseudo-unipolar neurons, in which the nucleus of each of these pseudo-unipolar neurons will be central, and it contains many satellite cells. So groups of neurons are seen between bundles of these nerve fibers, The size of the ganglia is quite large. Now we'll go on to slide number 13. So try to identify the slide and give relevant points in favor of its identification. So in this slide, you can see multipolar neurons. So this individual neurons contain eccentrically placed nucleus, and there are few satellite cells. Both the neurons as well as the fibers are scattered. So the given slide is autonomic ganglia. So capsule will be thin. So it contains multipolar neurons. Nucleus will be eccentric with few satellite cells. Both the neurons and fibers are scattered. When you take the overall size of the ganglia, it will be comparatively smaller. Next, coming to slide number 14. So now we'll take up the lymphoid organs. So try to identify the slide and give points in favor of its identification. You can see the capsule with the subcapsular sinus. Number of lymphatic nodules are seen in the cortical region. In the medulla, the lymphocytes are arranged in the form of anastomotic cords. The given slide is a lymph node. So it is surrounded by capsule with subcapsular sinus. The capsule sends in trabeculae and it contains the trabecular sinus. The lymphatic tissue is divided into outer cortex and inner medulla. The outer cortex contains lymphatic nodules, while the inner medulla has lymphocytes which are arranged in the form of anastomosing cords. Yes, next we'll go on to slide number 15. So try to identify the slide and give points in favor of its identification. Here we can observe the trabeculae. White pulp is seen with eccentrically placed arteriole. Red pulp with blood sinuses and splenic cords. The given slide is spleen. So cut sections of trabeculae will be seen. The tissue is divided into white pulp and red pulp. The white pulp, you can see the lymphocytes arranged in the form of a nodule with eccentrically placed arteriole. The red pulp contains large blood sinuses teamed with RBCs. In between the blood sinuses, lymphocytes are arranged in cords called as splenic cords or cords of Billroth. So now we'll go on to slide number 16. Try to identify the slide and give points in favor of its identification. You can see the epithelium, which comprises of non-keratinized stratified squamous epithelium. This epithelium dips in to form what is called as a crypt. So lymphatic nodules are seen and even mucous glands have been focused. So the given slide is that of a tonsil. It is lined by non-keratinized stratified squamous epithelium. This epithelium dips into the underlying tissue to form the tonsillar crypt. Lymphatic nodules are present, which exhibit a germinal center. Mucous salivary acini are seen. Coming to the next slide, so try to identify this slide and give a point in favor of its identification. Here, the capsule and septa are visible. This tissue is divided into outer densely packed cortex and inner less densely packed medulla. So in the medulla you can see the Hessel's corpuscle, also called as thymic corpuscle. So the given slide is that of thymus. It is covered by capsule. Septa within the parenchyma form incomplete lobules. Each lobule has a densely packed outer cortex and a centrally pale region called medulla. Lymphocytes in the cortex are small and closely packed and densely stained nucleus. In medulla, which is less densely packed cells, shows the presence of Hessel's or thymic corpuscle.